Before we begin, a disclaimer. This video is not to be used to come to a halachic ruling. Every real case must be discussed with a competent Orthodox rabbi, a posek, especially one experienced in medical halakha. The question is this. According to Jewish law, are we allowed to remove life support, to pull the plug, when someone is critically ill and may not recover?
Don't make the mistake of having the most important issues that you're going to address in your life, end-of-life care about your loved ones, and think that you can ad-lib and make it up as you go along. This is too important.
What follows is a basic Jewish legal framework. Its purpose is to help you prepare for an informed, serious conversation with the proper rabbinic authority.
Knowing how to approach the end of life is a wisdom. Judaism is a tremendous body of wisdom that is deep, that is meaningful, that is practical. And in order to answer these questions, first you have to realize that there are truths here. You know, truths don't necessarily always like your feelings. Sometimes you have to do what's hard. But the most important thing is to find somebody who is very knowledgeable in that wisdom and avail yourself of that wisdom. I'm a board-certified internal medicine doctor. Went to Harvard Medical School. Did my residency at the Brigham and Women's Hospital. I did research both at Harvard and MIT on ventilators, and then went to Eretz Yisrael, was in yeshiva, first Yeshivas Eshet Torah in the old city of Yerushalayim. Learned in the Mir for about 2 years, and then the opportunity came to open up what's called a long-term acute care hospital, an LTAC. So we opened up the first one in New Jersey. And so what I specialize in now for the last 25 years is taking care of patients that we call chronically critically ill. Most of my patients come to us from having been in an intensive care unit, mostly vent-dependent respiratory failure patients, weaning them off the ventilator and dealing with all the other multiple complications that this very, very sick patient population has.
According to mainstream Orthodox Jewish law, you generally may not actively remove a respirator or a feeding tube if they are sustaining life. There are limited situations where withholding treatment or choosing not to escalate treatment may be permitted. Those two actions are very different in Jewish law, or halacha. Everything begins with how Jewish law defines death. The dominant Orthodox view is this. Death means the irreversible stopping of breathing and heartbeat. Brain death alone is not considered death by most poskim. So even if a patient is declared brain dead by medical standards, if the heart is still beating, that person is considered alive according to most Orthodox authorities. Some rabbis accept brain death in very narrow cases, but that is not the mainstream view. Jewish law is cautious for a reason. Every moment of life has infinite value.
A 6-year-old boy's life is of infinite value, and a 96-year-old man's life is of infinite value. You can't compare infinite and infinite. So the first thing is our general approach is all life is sacred and needs to be preserved to the extent possible. We're living in a world now where a person's worth is determined not by who they are, by what they do. If you can't play tennis on the weekends, if you can't go to a movie, if you can't have some activity, then why is life worth living? You know, the Jewish perspective is very, very different. The value of the person is infinite, and as long as that soul is in that body, there's no calculus of someone's life being any less valuable than anyone else's. We have to realize if someone's lying in bed, and they may have had a stroke, they may be very sick, they may not be communicative, but still we have to have the humility to realize we don't really understand what's going on in their head. We don't really understand what's going on in their brain. There've been plenty of stories of people who were comatose, who came back, who had plenty of things to tell, some of them very embarrassing. So I think having the attitude that we don't decide when someone's born, and we don't decide when someone dies, that those are decisions that are made at a much higher pay scale than we have. That's above our pay grade. God is in charge.
Halacha does not say life must be prolonged at all costs. But it does say this: we do not actively shorten life.
You can't do anything proactively to limit someone's life. You can't end their life. That is well entrenched in Jewish law, going all the way back to the Talmud. To take away a moment of someone's life can be tantamount to murder.
Basic life-sustaining care is treated very strictly in halakha. We are obligated to supply oxygen, nutrition, hydration, and breathing support once already in place.
Most of our rabbis think to give them food, even in a way that's not the normal way, is consistent with how Jewish wisdom would inform that issue.
Practically speaking, families should not make these decisions alone. They should gather clear medical facts, understand the prognosis, and every real case requires rabbinic guidance, because the details matter enormously. End-of-life medicine doesn't happen in a vacuum. Often without realizing it, our medical decisions are shaped not only by doctors and diagnoses, but by law, culture, and prevailing ideas of compassion. In New York, for example, physician-assisted suicide is treated as a legitimate medical option. That reality affects hospital policy, doctors' treatment decisions, and the care, or lack of care, provided by nurses at the end of life.
I take care of lots of patients that lots of people and lots of other doctors in the general kind of medical milieu will think are not worth necessarily caring for. I have story after story of patients I've taken care of, patients who were denied admittance to an intensive care unit in Manhattan because they were too old, who came to us, potentially got a feeding tube placed, got their medical issues addressed, and then went back to Brooklyn, back to their shul, back to their life. When you go to a place and they talk about comfort care is a code word in the hospital that we're not going to aggressively evaluate, we're not going to aggressively diagnose, and we're not going to aggressively treat. We're going to do whatever we can to, quote unquote, keep the person comfortable, even if that may mean that it may truncate their life. Palliative care, hospice, there's some great palliative care doctors and some great people who are involved in hospice. However, their attitude is, if the question is dying this week or dying next week, it might as well be this week. If you're going to die this month or next month, it might as well be this month. Our attitude is the exact opposite. If it's a question of this week and next week, let it be next week. So we're coming from a totally different perspective. Unfortunately, most people in the hospice world look for the good death, and the good death means the quicker, the better, the less painful. You know, I don't want to paint all hospice providers with a broad negative brush, but you should have a very high index of suspicion that if someone talks about hospice care, that they should do it that's consistent with Jewish values. I've been in a situation where I have a patient in the community and they're on hospice care, and they called me up, and I come to the house, and the person has an underlying malignancy, they have cancer, and I listen to them, and they clearly have a bad pneumonia. And if we potentially gave them antibiotics, we could treat the pneumonia. The hospice nurse is in the house, and I say, you know, this person looks like they're going to die unless we give them intravenous antibiotics and treat the pneumonia. They said, yeah, that's right. We've been waiting for this. I've been here all night. Well, I've been waiting for this. They're going to die. And patients with cancer, they never die of their underlying cancer. They always die of complications. So this is the moment that we were waiting for. And I turned to the patient's family. I said, is this what you want, or did you want to? No, we never wanted this. They said, we're going to revoke hospice care. We're going to take the patient to the hospital. And we took the patient to the hospital. We treated him with intravenous antibiotics. They lived for months. Death lasts a long time. There's no reason to rush it. So the fact that your loved one cares about your feelings and your sentiments is all the more so of what you need to do the right thing for them. However, you're not obligated to live under the mistaken assumptions that your parent is making. If your parent thought that the best thing in the world for them was to do something that was against the laws of gravity, you would tell them, excuse me, I can't let you jump out of the window, whether you like to do it or not, because that is a fatal, terrible decision that goes against the laws of nature. You don't have to listen to your parent and do something that goes against their wishes because they don't understand spiritual laws. That's number one. Number two is the best thing that you can do for yourself is to spend time at the end of your parents' life with them. I will tell you a story. My father was 90 years old and he was diagnosed with a malignancy. From the time he was diagnosed to the time he died was 3 months. I took 3 months off of my life and I left here and I spent 3 months at the bedside of my father. You're with your father, you're with your mother, at their bedside in their time of need. They think it's an inconvenience. They think what they're doing is bad for you. What they're doing is the best thing for you, to connect with the person that you love in a way that's sensitive, in a way that's giving. I wouldn't trade those 3 months for any other 3 months of my life. There is a tremendous Jewish exhortation to take care of people suffering. I'm with you. I'm on the same page. We want to minimize the suffering. We have a lot of tools in the toolbox to alleviate suffering, both medications and other things, other modalities to take patients out of pain. If I see a patient is dying and they're actively dying, there's no mitzvah to compress their chest and to put them through a process just for the sake of saying that we've done it. But when you can potentially prolong someone's life, we want to treat their suffering and do what we can to give them the best and extend their life. The goal of Jewish law is to give them the best and the longest. I'm taking care of currently 100-year-old, and he's doing well, and the plan is to leave the hospital tomorrow. He was in the intensive care unit of the hospital. I had to lobby and advocate and fight to have them realize that a 100-year-old person is worth treating, is worth intubating, is worth putting a tracheostomy tube in, is worth putting a feeding tube in. And we're weeks later, he's doing excellent. The family's tremendously appreciative. The candy platter behind me is their token of thanks that what we've done for their father and grandfather. The perspective is we're approaching a patient that their life is sacred and of inestimable value. And every moment that they're here, by definition, is accomplishing things that may have eternal ramifications. We believe that every person came to this world with a purpose and gave you a very short amount of time in this world. It's a blink of an eye. 60 years, 70 years, 80 years, 90 years. Gave you a blink of time in the span of history, in the span of eternity. And what you do in this world bears eternal dividends. You don't look at pain as suffering. You look at pain as challenge, pain as opportunity. It's painful by definition, but painful is also meaningful. There's a reason why people are in painful situations. Those are life-defining and life-challenging. And how you stand up to those challenges is the reason why we're here. Hospital is a very, very interesting thing. You put on a white coat, and obviously you're the expert. You have all these people wearing scrubs. They're the experts. Don't be intimidated. Ask questions. Get them to explain things to you. And if you need them to talk to somebody, say, listen, I have a friend who is a rabbi. I have a friend who's an Orthodox doctor. I have a friend that wants to hear what's going on. Don't go into a hospital thinking that you have to shelve your feelings, your impressions, and just give it over to the nurse in the intensive care unit who's all of 32 years old, who's had, 1 decade of life experience. Be confident, get the right people, access the wisdom, and make the right decisions. When I was in the Brigham and Women's Hospital, I was actually the senior resident in the emergency department at the time, and we heard the overhead alarm that someone was having a cardiac arrest in the cafeteria. which is not the typical place where people have a cardiac arrest. So as kind of like being in the emergency department, and I ran up with my team and saw an elderly lady lying on the floor and essentially in asystole. Her heart had stopped. They were working on her. By the time I got there, they gave her some medications. They gave some epinephrine. She had a little bit of a ventricular fibrillation. And I came there with my defibrillator. We started shocking her and, not coming back. We were resuscitating her for, quite some time. And everyone else said, okay, she died. And I said, no, 1 second. This is a lady who came for an outpatient apartment. She was having lunch with her husband. I'm not ready to throw in the towel yet. And so I continued to work on her, and people started to dissipate and this. And after multiple shocks, the first person, her heart rate came back. We started seeing a squiggle on the monitor, and we started on medications. We brought her upstairs to the intensive care unit. She was resuscitated. And I went back to work, and through the day, I'm looking at the computer following her progress. And I said, after my shift downstairs working, I'll go up and I'll check and see how she's doing. And I came up there. By the time I got up there, she was up, she was awake, she was alert. And I walked into the room, and her husband said, honey, that's the man I was telling you about. That's the man I was telling you about. I said, what do you mean? What you said? She said, when they made everyone leave, I was standing behind the door, but there was a glass window in the door. I was watching that whole resuscitative effort. I saw everyone give up, and I saw that you didn't give up. And I saw one more shock, and I saw that you're the one who resuscitated my wife back to life. I don't know how we can ever thank you. So his wife said, I can tell you how I would never thank you. Anything ever that happens in my life that's good, I'm going to say thank you to you. I'll say to myself, thank you, Dr. Lebowitz. When I play with my grandchildren, when I go for a walk with my husband on the beach, I'll spend my life thanking you. It's a very dramatic moment for me, and a life-changing moment. And you realize that, where everyone is willing to give up, maybe it's worth trying to go a little bit of that extra mile.